Welcome back. The Department of Basic Education has extended the marking of grade 12 exam papers due to a shortage of markers after some withdrew or declined to work, often because of COVID-19 fears. This has been revealed by an education official during a media briefing. It was also revealed that marking would go on for 18 days as opposed to 12 to 14 days in previous years. Marking started on the 4th of January and was expected to be completed on the 22nd of January. It's been said that to date, 2,703 of the 46,024 markers have withdrawn. Naptosa Executive Director Basil Manuel joins us now to talk about this. Very good evening to you. Thank you so much for joining us, Mr. Manuel. And once again, compliments.
It's a pleasure to be.
Compliments of the season. Okay, so let's talk about this very worrying situation. We know that the president has extended alert level 3. I've just mentioned that marking has also been extended. Is this at least some consolation that the restrictions remain in place for those who had fears?
Well, yes, there is a measure of I suppose, comfort that somebody is noticing all the problems that there are there. Not that solves the problem. Of course, the problem is ours to manage. If we don't manage it, then, of course, it will still continue growing. And that is the same in the marking centres. It'll be the same in the schools and in general society. We, as the population, need to be managing this.
We had news, I think, today that 2 KwaZulu-Natal markers are reported to have died from COVID-19. Have you had any more reports to this effect anywhere else in the country?
Not any deaths. However, there have been some withdrawals. We've had some from the Eastern Cape. We've had also in KwaZulu-Natal too, and of course in the Western Cape as well. But they are ones and twos, where people have now fallen ill or feel ill, and they've asked to withdraw. There have been other reasons for withdrawal as well, and of course illness at home, death at home, etc. So the number of withdrawals, which sounds enormously high, 2,700, almost 2,800, most of them happened before the marking. During the marking cycle, we are at about 200 to 250 markers that have withdrawn whilst marking had started. All the others withdrew just as marking was about to begin. So the replacement was obviously going to be a challenge. And even now we see that our substitute lists are just about exhausted. And you can't simply just call other people up if they haven't been through the basics in terms of knowing that they qualify and meet the criteria. So this was known from the very outset, and hence the 22 days of marking, because many of the markers expected to finish much earlier than that. But if there's a shortage of markers, the existing markers have to carry a heavier load, and it pushes the days back, obviously.
Are you concerned, though, because, as you mentioned, some of those are pulled out before the marking actually began. Some tested positive before the marking has begun. I mentioned the 2 deaths in KwaZulu-Natal. I believe there's a report of 1 in the Midlands as well. So that means there is cause for some to be concerned. The KwaZulu-Natal Premier has also called for those who are not adhering to COVID-19 regulations to be shut down. So meaning that there is a genuine and legitimate fear that not all centres are adhering to protocol.
Absolutely. And this is what we've been pleading for from the beginning. We knew that given where we were within the COVID pandemic, that we are going to have some outbreaks. That was a given, particularly because the majority of learners of markers are not living on the premises. They're not residential. So they're traveling in and out, either to friends or to family, depending on where the marking centre is. That creates a risk because you are going to meet other people and then you don't know where they've been, and you bring something in. But of course, as soon as somebody passes on or somebody falls ill at a centre, it sparks fear and anxiety. And worse still, somebody dies. I mean, you can't even imagine how people start feeling there. And what we've asked for are 2 things. Number one, that the centres have to observe religiously every single bit of the protocol. If they can't do that, then they are failing and endangering the lives of all those markers there. Secondly, it is the markers themselves, the checkers that make up a significant number. And then, of course, we have the ancillary staff, the cleaning staff, the caterers, etc. So it is a large group of people that you are trying to control and trying to ensure that they realize the seriousness of what is there. And unfortunately, it doesn't always happen. So yes, there is cause for concern. We've been cautiously happy up to now that, in fact, things seem to have been going along quite nicely. But, of course, we always knew that there would be incidents that will arise.
I want to talk about what SABC in the Eastern Cape is asking for instance. They're still calling for the provision of PPE. That is very concerning if we're hearing for the Department of Basic Education that they believe that they are ready to open schools. So, I mean, you mentioned that you're dealing with a sample size here at the marking centres, including all other support staff. But if we're looking at nationally, are we really ready to open the 2021 academic year, given these problems?
Naptosa has always supported the idea that we need to open schools sooner rather than later. But it is a qualified, we need to open schools. The qualification is not at all costs. All the health and safety protocols must be in place. And of course, our people with the science must tell us that this is the right time to do that. And there are a number of things that are now starting to show themselves. Number one, if a province cannot at this stage tell us that they have all the PPEs in place, there's something seriously wrong. It's a dereliction of duty, simply because everybody knows what the requirements are. Everybody knows that there's a new intake in every single school, whether it be primary school or high school. They need masks. The masks from last year must have perished a long time ago, so they need to be replaced. It's cleaning materials and all the like. I was hoping, and maybe against hope itself, that this will not be the debate now, because everybody surely knows. I thought we will be looking at a more elevated discussion about how do we take the lessons of 2020 forward into 2021. In addition, we heard this morning from Professor Abdul Karim expressing concern about the spike in infections in communities. And, of course, the resultant impact that that could have on schools when they open, because teachers and learners are members of the broader community. And, of course, this has gotten our radar up, and we are listening very carefully. As a result, we've asked, as Naptosa, as well as the other unions, SATU and the other teacher unions, for an urgent meeting with the ministry and the DG, so that we can have this discussion.
And we certainly are going to keep our eyes on that, our ears open for that urgent meeting. Thank you so much for joining us.